Got a team teaching today with Dr. Colgan. But this was a very, very interesting and timely article that just came out about reversal of diabetic neuropathy symptoms with vitamin D in a type 1 diabetic patient. So if you think about the patients that you have in your office, you've got a diabetic type 1, how about diabetic type 2? And if all you're doing is giving them vitamin D, you're going to help reverse their diabetic symptoms. What if you added the light and the vibration and then arginine and your skills with the stick and a diet and reduce the inflammation and give them their vitamins? So this is hardcore evidence of what we're doing is working. Let's see if I can make this network here. Okay, so here's the article last year, 2012. Okay, that's the actual PubMed. So what is the deal here? I'm going to review this one more time, but what is the deal here? These are Indians, right? So this is how you get your vitamin D, by living out in the sun in a loincloth, right? And being outside in the sun the majority of the time that people were outside. But now we live in cars and houses and clothing. And so as a nation, as a world, we're low in vitamin D. We're deficient in vitamin D, the sunshine vitamin. Okay? And now we have to wear sunscreen, and we have to sit under the umbrella because the sun now, after 50 million years, causes cancer. Wait a minute. The sun causes cancer? It's the same sun. Maybe we're susceptible to it. So again, sunlight comes in, it touches the skin, and it helps make the vitamin D with the help of your liver and all this other stuff, and the kidneys and parathyroid hormone. And I'm not the best at all this stuff, but it uses your diet and the sun to make vitamin D. And if you take it in a pill form, guess what? You don't get it. It is not utilized, okay? Because it's not so much in the gut to get these things. So here's the article. Case reports in endocrinology. Vitamin D deficiency has been associated with both type 1 and type 2 diabetes, as well as both microvascular and macrovascular complications of diabetes. Now, here's the point that I tell my patients, because every patient that comes in gets a vitamin D. Okay? I'm not sure if I'm going to have a chance to discuss this, but here's what I'm saying. If we saw the sunshine vitamin, your skin is what makes vitamin D. If you have small fiber peripheral neuropathy, you don't have any nerves in your skin, right? So how do you think the metabolic processes are? They're deficient. So here's normal levels of vitamin D. As a nation, we are here. If you have neuropathy, you're probably down here. And if you have painful neuropathy, you're way down here. So we have to get the vitamin D into the system. Okay? Vitamin D deficiency has been shown to be more common in diabetic patients who have symptoms of distal symmetrical polyneuropathy. In addition, vitamin D deficiency has been associated with lower pain thresholds, which increase when vitamin D deficiency is corrected. Wow, that's what we're dealing with. That means they have more sensitive to pain, like the hyperalgesia to the pinprick or the pinwheel. I describe a type 1 diabetic patient with neuropathic symptoms so severe that he could not work and for which he needed narcotics for pain management, and whose symptoms improved dramatically with the correction of his vitamin D deficiency. Okay? So vitamin D deficiency has, in addition to bone disease, been implicated as a cofactor in giving you vitamin D, giving you diabetes and autoimmune heart disease and cancer. Vitamin D is diagnosed in those with established diabetes, may prevent or delay the onset of diabetic complications. Okay? Vitamin D replacement may prevent it. In addition, pain thresholds of multiple etiologies have been reported to be lowered with vitamin D deficiencies and then fixed when you correct it. Distal symmetrical neuropathy is diagnosed itself. However, it is recommended that paraproteinemia and B12 deficiency are eliminated with plasma protein B levels. Blah, 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 blah. Okay. This is a 38-year-old type 1 diabetic, right? Tingling, burning pain. 10 years. Relief of symptoms with tricyclics, gabapentin, pregabalin, also Neurontin, and Lyrica. He had to stop working. He had small fiber neuropathy, all reflexes and vibration, but hyperesthesia to painful stimulus at the levels of the ankle. That's just what we said. Right? So he didn't have vitamin B12 deficiency, of course he didn't. And he had an A1C of 7.0. His vitamin D levels were performed, and he had 16.5. So that's very, very low. But they gave him 50,000 units of D2. I don't know why they gave him D2. We like D3. Within 2 weeks, his symptoms began to decrease. That's what we like. Within 4 weeks, he had improved to a level which he didn't take his oxycodone anymore. And then he gave him a little bit of this and a little bit of that. His levels went to 48. Now, we like levels, in talking to different people, we like levels of our vitamin D of about 80. 100 is too much. So when less than 100, but around 80. So he was still deficient, but he had significant reduction in his pain, and he was just taking this. If a proven vitamin deficiency exists, the correction of the deficiency may be helpful. In this case, correction of vitamin D deficiency was undertaken to prevent the development of protein manifestations and not to treat the symptoms of diabetic neuropathy. However, to my surprise, the vitamin D resulted in a very significant improvement in his neuropathic symptoms. Neuropathy is some form as 60 to 70% of diabetic patients. Okay, so why don't we give them vitamin D? Animal studies have shown that vitamin D deficiency is associated with low levels of neurotrophins, like growth factor. It is a neurohormone. Okay? Vitamin D, through its receptors, modulates neuronal differentiation as well as neuronal growth and function. So if your objective in a neuropathy patient is to regenerate the nerves, well, as much positive neuronal function as possible. In rats, the production of nerve growth factor, which is required for the development and survival of both sympathetic and sensory neurons, decreases in the presence of vitamin D deficiency. In fact, vitamin D deficient diabetic animals, correction of vitamin D deficiency resulted in improvement in nerve growth factor function. Decrease in neurotrophins and defective calcium homeostasis leaves the nerves vulnerable to toxins, including hyperglycemia. As a result, a deficiency of vitamin D impairs nociceptor function, worsens nerve damage, and lowers the pain threshold. At the National Health and Nutrition Survey, vitamin D defined as less than 300 in adults with diabetes associated with symptoms of neuropathy. In another study, vitamin D levels were not correlated with this, but it hurts all these other things. Okay? Perspective, a non-randomized 51 type 1 diabetics with painful neuropathy show a 50% decrease in pain scores with vitamin D supplementation. That's pretty good. Topical vitamin D application also helps the pain. This is a case study that shows the correction or restoring of vitamin D levels to somewhat normal range gives less neuropathic symptoms. Okay? So I think it's important to look at these things. You know, there's the references, there it is. And this is another one that we did the other day. Vitamin D is an effective analgesic for type 2 diabetics with neuropathic pain. Okay? We know that now. This is that article that they did 51 patients, and we have reviewed that in a previous webinar. Again, they were under 25D was their average, so that's pretty low. So we can review that. You can review that, read this one online, or review that other webinar. But so vitamin D insufficiency is unrecognized and may be a significant contributor to neuropathic pain in these patients. But does vitamin D deficiency play a role in peripheral neuropathy? Yep, it sure does. This is some of the other abstracts that they must have talked about. This is also with the results. Vitamin D deficiency is an independent risk factor for diabetic neuropathy. Okay, it could prevent or delay its onset. So even in all of your patients that come in, they need this. Prevalence and clinical features of peripheral neuropathy among diabetics in Saudi Arabia. Okay. 37 patients had this type of thing. I mean, it's important to give them, this is the exam that they do. And what is that vitamin D deficiency? Okay. Potentials to improve diabetic control in vitamin D patients. Okay. Adequate reserves patients. It helps them. It helps all patients. Association of vitamin D and diabetic neuropathy in a national representative sample. This is a huge sample of patients, of about 600 patients. High prevalence of vitamin D deficiency in type 1 diabetes in healthy children. Prevalence and severity of vitamin D deficiency in patients with diabetic foot infection. Okay, and there's that article there. So it's huge. The role of vitamins D in the health of the nervous system. This is very recent. Okay? Schizophrenia, autism, Parkinson's, Alzheimer's. You need this stuff. So this is a recent seminar or conference that Dr. Colgan went to. Tell us a little bit about this, Chris. What are these happy people doing here?
Well, these happy people were those that qualified, and not only did they get an iPad mini, but they also got a check for $1,000 for what they did, and that was a pre-launch event. So the company 10, standing for Team Effort Network, is now officially in pre-launch. And so that's there's Mark Rosales in the middle with Hector Medina, and these two have been very instrumental. And Hector's there in Phoenix, right by you.
Mm-hmm.
And all these people here have been instrumental at pushing the word about these spray vitamins. And the amazing thing I'm getting from this are the incredible stories that these people are sharing with me on how it has affected the people that they've been sharing the product with. Their stories are off the charts. People losing weight without doing anything at all but spraying a vitamin in there, or the vitamin D3 helping them sleeping better at night, or they didn't even know it could help them sleep better at night until I mentioned something to them. And they're just having a lot of fun, and they're seeing that people are a lot more compliant to taking these vitamins because it's easy. You just keep it in the purse, spray it 6 to 8 times a day, and you're done. But there's a lot of energy, a lot of fun, and you know, the health professionals are there. There's a naturopath there. There's Dr. Siva and Dan Austin from the High Desert Health. They did a whole presentation on vitamin D and the effectiveness on, just like you were just talking about, with diabetes, heart disease, and just in general overall health for proactive use for immune systems, and with children too. You know, how children need this. You know, children should be taking about 1,000 or just under 1,000 IUs, which is 1 or 2 sprays a day of vitamin D. So it was really something.
We know that the key is not just giving them the vitamin D, but making sure it's absorbed. Excuse me. Nico took her vitamin D levels were 30, and she took some of our vitamin D pills that we have, and it went to 40, and then she took the spray, it went to 80, and then it went to 100. So
wow.
It really did go up, and it has positive effects. But this 10 situation, what other points do they have? What other spray vitamins are they reaching into?
Well, I would say other than the D3, which is pretty much what they were showcasing, there's B12, which is essential for the gut and brain and central nervous system. They also have what is called Dream Time for people who are having problems sleeping at night. So they've been spraying that. And another one called it's a metabolic booster. So if you're about ready to work out or do something physical, spray that in your mouth and it'll take you right through the roof. But these are the one thing about that metabolic booster that they're talking about is that people are losing weight from it. And so I do a lot of weight loss in the clinic too, and we've been having our patients use this spray, and it's created effects. I mean, people are losing weight because they're restoring their metabolism just by spraying the simple vitamin in their mouth every day. Without doing anything different than what they were doing before, they are losing weight. And that was something that these people were sharing with us at this convention, and that they noticed, hey, not only are we losing weight, but we just feel healthier. One person even claimed that their blood sugar levels have changed, and I think there was also someone there I spoke about who had neuropathy, and they shared that, yeah, I'm noticing an improvement of symptoms, and this is the only thing I did different. So
I think
looks like
that these are a great adjunct to your office. I mean, if you're doing weight loss or if you have these pre-diabetic patients, they need that metabolic boost. None of the patients can sleep because of the pain. So you could say you're going to sell $100 worth of vitamins that these people are going to use every month. And I think for $25 each, it's a deal.
yeah, that's what we're selling them for. I mean, I personally take 4 of these sprays on a daily basis. So, I mean, that's just what I do, and it's been good for me.
Let's see if this handsome Mr. Medina, Hector, has something to say. Hector, did you hook up a mic today? Oh man, come on. We want to hear you talk, Hector. Oh, you can type something. But we're probably going to do this talk again, don't you think, Chris? I mean, this is powerful
Yeah,
stuff
absolutely. I mean,
that we're
this is
talking about.
groundbreaking. You know, people just want something different. I mean, they want to take a vitamin that they could absorb that's healthy for them and that can make a difference in their life immediately. Again, like you were talking about absorbability, 95% absorbability. And the exciting thing I'm starting to hear more about are talking to the mothers and finding out what their results are with their children. That's going to be the big thing. I mean, they're already getting pushed with a lot of different things in their body as it is. And it seems like kids aren't getting any healthier as time goes on. They're getting sicker and sicker because of what the drug companies are pushing. And so it's going to be interesting to hear down the road some of the success stories we're going to be getting from this.
Okay, then. Well, let's just go forward, Chris, and you could jump in. We'll get you back in a second, but let's go forward and look at this. I think that's a great development, and we'll be getting in to at the ground floor of this thing, won't we? No, I mean, that's what's great. So let's take a look at this one that